I'm Crystal Sparks here at Scientific Sessions, joined here with Dr. Jim Min, founder and CEO of Cleerly, a health tech organization, health tech startup. Now I say startup, but it's really been 6 years since you've started developing this groundbreaking technology. Talk to me about what you're doing here this week at Scientific Sessions and how is it going?
Yeah, thank you. Thanks for having us, and we're excited to be here at the AHA. We've got a few things that we're doing. We were invited very generously to give a few talks and serve on a few panels. We've got a booth over here that people can check out what we're doing, and we've got a number of scientific studies that we're presenting here at the AHA as well.
What is the number one thing people are asking you and are interested in about what you're doing and the work that you've been working on?
Yeah, I think there's two things. The first thing they ask is, well, what is it that you do? And what we did was we took what we were doing when I used to be a cardiologist at New York Presbyterian Hospital and Cornell Medical College. And there we had a very different approach to cardiovascular disease evaluation and education and treatment and tracking. And it was very successful. Like, we saw very great results and outcomes for our patients. But it was a very manual process that leveraged advanced phenotyping on imaging using CT scans of the heart. And then we realized that the educational part was very tough for people who weren't imagers. Then we realized that the patients didn't quite understand everything we were talking about. Then we realized that we were treating patients much more aggressively from a preventive standpoint. And then we also realized that we were tracking people in a quantitative fashion. But all of that was very manual. So about 6 years ago, we started a company called Cleerly. The goal of Cleerly was really to be a comprehensive and standardized, but most importantly, a personalized care management platform for evaluation, education, treatment, and tracking of heart disease.
So why is it important that you are here at Scientific Sessions this week?
Yeah, it's a great question. I think for two reasons. One of them is just to get the word out. I think we're still a startup, even though, as you point out, we are 6 years old, so maybe we're in our teenage, more gangly years. But the second is, like, we announced today that we will soon be embarking on a large 7,500 patient randomized control trial, really to test the hypothesis of whether or not Cleerly can guide screening efforts, similar to the way we use imaging for mammograms or imaging for colonoscopies or imaging for lung CTs and lung cancer screening. We believe that evaluation of an individual's actual heart disease using non-invasive imaging, it will be superior to looking at risk factors of heart disease. And we don't think that they're mutually exclusive, but we do believe that we can find a better way to identify the one person every 2 seconds who's dying of cardiovascular disease.
So you made that huge announcement here at Scientific Sessions. Can you talk to me about why Scientific Sessions is such an important part of what you're doing right now and the role that it's playing in what you're working on?
Yeah, I mean, first of all, the American Heart Association Scientific Sessions is the gold standard, right? It's just an amazing venue. We've got a partnership with the American Heart Association. We're in their Innovators Network. Within the context of this randomized control trial, the American Heart Association is providing the educational content around life's essential aid. So we believe in everything that the AHA is doing. We're glad that they believe in some of the things that we're doing. And yeah, we're ready to go out and try to figure out how to screen the world and save lives.
Well, I'm excited to see what you do, and I believe in you.
All right, thanks.
Thank you so much for Scientific Sessions here on the floor. I'm Crystal Sparks.